Hello, my name is Michelle, and today I will be performing a focused respiratory assessment on my patient Kyle Reeves, who currently lives with cystic fibrosis. So the first thing I'm going to do is knock on the door, introduce myself, and verify my patient. So knock knock. Hello, my name is Michelle. I'm going to be your nurse today. Can I please have your first, last name, and date of birth?
Kyle Reeves, January 17, 2004.
Okay. And I went ahead and verified my patient, and it is correct. So Mr. Reeves, I understand you've been having a cough for the last 2 weeks, and you're feeling a little ill. Is that true?
That's correct.
Okay, I'm going to go ahead and perform a focused respiratory assessment if that's okay with you. Okay, and before we do that, I do have a few questions to ask, just so I could get a little understanding on the history of your cough and how long it's been going on for. Okay, so how long have you had your cough for?
Between 2 and 3 weeks.
Okay. Do you have any pain with your cough?
No.
No? Is it a dry cough or a wet cough?
Wet cough.
Okay, and what kind of mucus are you seeing or sputum when you cough?
It's like in the morning it's really thick and yellow.
Okay. So have you taken any medications for in order to alleviate your signs and symptoms of your cough?
No.
Okay. Do you experience chest pains when you cough, or since you got your cough?
No, I don't.
No?
It's more just clearing airways.
Okay, have you noticed any changes in your diet when your cough started?
No.
No? Do you have history of cystic fibrosis in your family?
No, we don't.
No? Okay. Are you able to normally walk, or do you get tired?
I can walk, but once the distance starts to pick up, then it usually gets pretty hard for me.
Okay, and then do you have history of smoking?
I do.
Okay, how many cigarettes and for how long have you been smoking? How many cigarettes a day do you smoke, and for how long have you been smoking for?
Probably smoke between like 6 and 10 cigarettes a day. Picked it up about 2 years ago.
Okay, so I would need you to possibly stop smoking. We could look into alternatives for cessation of smoking, because smoking is bad for your cough, if you didn't already know. I already did ask if you're able to ambulate, and you said you get tired with distances. Okay, so can I please have you sit at the edge of the bed? I want to go ahead and listen to your lungs and do a few things. Okay, so the first thing I'm going to do is I'm going to go ahead and take my patient's vital signs, and I'm going to observe his respiratory rate and oxygen saturation and ensure that it is normal, and I will note that in my chart. The next thing I'm going to do is listen to his lung sounds. So I'm going to listen to his lung sounds in a zigzag manner, and that way I could compare the opposite side of the lungs and see how they sound. So I'm going to listen to the anterior and posterior side. Okay, Mr. Reeves, I'm going to have you take a deep breath in through the nose, out through the mouth. Okay. And I'm going to listen to your backside now. Now, I did observe some crackles, so that is a telltale sign that he has fluid in his lungs, and we're going to have to take a look at that. The next thing I'm gonna do is I will check to see if my patient has cyanosis around his lips or on his fingertips. Okay. And he does not have cyanosis, but if he did, that means that he has poor circulation and oxygenation on the outer extremities of the body, and that would present itself in a bluish or purplish tone to the outer extremities, such as the fingertips, around the lips, or on the tip of the nose. The next thing I'm going to do is I will check for capillary refill. Okay, and his capillary refill is 2 seconds, so that is normal. And if it were not normal, that is poor perfusion, and we would also have to take a look at why that is happening. The next thing I'm going to do is I'm going to check to see if my patient is using any of the accessory muscles in order to breathe. Okay, can I have you? Okay, that looks great. He is not using any accessory muscles to breathe, so that is a good sign. The next thing I'm going to do is I will check to see if when he breathes in and out, his chest is symmetrical, and if it's not, that is a sign that there's something possibly wrong with the lungs. Okay, so he looks fine, and I'm going to also check the back side. Okay, he looks great. And then the next thing I will look is observe to see if my patient is barrel chested. Now typically patients who exhibit barrel chesting, it is because their lungs do not properly release all of the oxygen, and it creates a barrel chest. And patients who suffer from respiratory diseases such as cystic fibrosis or chronic obstructive pulmonary disorder tend to have barrel chests. Okay, and then the next thing I'm going to do is I'm going to observe my patient's positioning when he breathes. Now sometimes when patients are in respiratory distress, they will sort of position themselves in a different manner in order for them to better be able to breathe. And he is not positioned in any awkward way, so that is good. The next thing I'm going to do is I will order lab values and I will observe them. Some of the lab values that I would order are PCO2 and ABG. Those lab values can tell me if my patient has elevated levels of carbon dioxide in their body, and it could also tell me if they are going into respiratory acidosis. And then the next thing I will do is I'm going to go ahead and take you on a little walk with me. So go ahead and stand up. Do you feel fine? Mm-hmm. Okay, let's go ahead and walk. Okay. Very good. Did you feel dizzy when you went on a walk?
I started to towards the end.
Okay, so my patient does feel a bit dizzy when he walks. So something that I would like to do is supplement oxygen possibly and position him in a high Fowler's position. Let's see, the next thing I'm going to do is, okay, and I think that's about it. I'm going to go ahead and reposition him back in bed and ask if he needs anything. So we're done. If you want to go ahead and sit in your bed, we're done. Do you need anything before I leave?
No.
No? Okay, thank you very much. Here's your call light. I'm going to perform hand hygiene and document everything I just saw.